Hello, good afternoon, everyone. Thanks for joining today's webinar. We're going to give a couple of minutes so everyone can join. You can start writing in the chat box if you like. Where are you participating from? Where are you visiting from? And we'll begin in a couple of minutes, okay? Thank you for being here. Okay, we have a lot of people. That's good. New York in the house, Tampa, Miami, Teresa from New Mexico. Thank you for joining. Okay, just continue to write in where you're coming from. We will start our webinar today. Our resource is Dr. Madeline Sampilo. She will be talking a little bit of transforming clinical supervision, integration of best practices for culturally responsive practice. Next slide, please. To hear today's presentation in Spanish, please go to the Interpretation tab on your Zoom panel and click Spanish. You can also mute the English speaker's voice clicking Mute Original Audio. Next slide, please. Now we will review a few housekeeping items. Today's event is being recorded and will be made available publicly through our website and other media channels. For today's webinar, all participants will be muted. Please make sure your computer speakers are turned on and up to hear today's presentation. If you are having technical issues, please send a message to the Hispanic and Latino Behavioral Health Center of Excellence on the chat box. If you have a question for our presenter, we ask that you use the Q&A tab on the toolbar. Simply type your question and hit send. We can address your questions to the presenter at the appropriate time during today's presentation or at the conclusion. We will be sharing a copy of today's presentation in PDF format through the chat box. We will also make a copy of today's presentation available to be downloaded through our website. You can find it under the name of today's event. A recording of today's webinar will be posted in our YouTube channel as well. Next slide, please. Once we complete the webinar, please complete the evaluation. The evaluation will help us know more about the opinion and thoughts about this presentation and what other topics and trainings would you like to see offered. A link to the evaluation will be shared through the chat. You can also scan the QR code at the end of the presentation to complete it. Next slide, please. Our mission is to advance and support the sustainability of behavioral health by promoting community-driven, culturally grounded, and person-centered prevention, treatment multiple pathways of recovery, and recovery support for Hispanic and Latino communities. And we strive to accomplish this mission through the development of dissemination of culturally informed, evidence-based behavioral health information, providing training and technical assistance, and supporting the growth and expansion of the behavioral health workforce that serves Latino communities. We would like to welcome and introduce today's speaker, Dr. Madeline Sampilo. Dr. Madeline Sampilo is a licensed clinical psychologist. She received her doctoral degree in clinical child psychology with specializations in pediatric psychology and a master of public health with specialization in social and behavioral aspects of public health from the University of Kansas. Dr. Sampilo's pedigree in education and training have allowed her to develop extensive experience in prevention, health promotion, and intervention. Dr. Sampilo currently serves as the Director of Behavioral Health for the All Hands Health Network at Lowry Children's Hospital Collaboration and works as a coordinating psychologist for the Mood, Anxiety, and ADHD Collaborative Care Program at Lowry Children's Hospital. Dr. Sampilo is particularly passionate about addressing structural and systematic drivers of behavioral health, access barriers, and partnerships with communities. She also serves on several national committees and work groups focused on promoting culturally and linguistically appropriate health service delivery. Dr. Sampilo has received several local and national awards for her work and service to communities who have been marginalized. Please give Dr. Sampilo a warm welcome. Take it away, doctor.
Thank you so much. Thank you so much for that bio, and thank you so much to all of you who are taking time out of your busy schedules to be here today. So I'm going to go ahead and launch into the presentation. Just to kind of give you a framework for kind of what we're going to cover today. We're going to talk briefly about the importance of ongoing training and culturally responsive supervision, discuss barriers to engaging in discussions of culture and clinical supervision, and then outline sort of these aspects of a toolkit that are designed to facilitate the provision of culturally responsive supervision. So we're really going to sort of take it from, let's talk about like why this is important, let's talk about why this is sometimes hard work, and then let's talk about ways that we can actually put this into practice. So I want to do a little bit of level setting just before we begin, because I think there's a lot of different terms that sort of get used interchangeably when it comes to talking about culturally responsive supervision. So I want to make sure that I'm being very clear about kind of how I'm differentiating maybe some of the other terms that you've heard, all of which are super important and really important for our discussion today. So multicultural supervision, you all long probably have been aware of that concept, a really helpful concept that was formulated a long time ago, like in the 70s, and sort of that movement, where really it was about integrating awareness of culture into not only our clinical practice, but in our supervision practices. So really trying to foster an awareness of culture and discussions of culture, including different worldviews, different perspectives, different cultural influences on health beliefs, on healthcare like seeking behavior, and then also even just like how we perceive treatment for mental health, right? Coming from that cultural lens. So really integrating all of that information and all of that knowledge into our practice, again, clinical practice and supervision. That's really sort of taking that multicultural lens to supervision. Culturally responsive care really focuses on trying to apply those same learnings to our practice of care in the context of the larger social context in which we live. So the larger, broader societal issues that we face. And then how I'm really sort of distilling down culturally responsive supervision is all of that, plus trying to also foster sort of an awareness that in supervision, generally there is this hierarchy of power, right? There's a supervisor and a supervisee. And so partly what we're trying to do with culturally responsive supervision is really adapt supervision to meet more of the cultural needs of the supervisee and frankly, the supervisor as well. But then also trying to really redress sort of those power dynamics in the supervision relationship that makes it unique. In terms of sort of thinking about how do we address these issues, how do we integrate these issues, but also in the context of this relationship where there is this kind of existing power differential and sometimes sort of this like fear of evaluation that can sometimes impact that relationship. So when we think about like why this is important, well, first and foremost, there is this changing demographic landscape. So we are going to encounter more multicultural patients and clients in our work. And so the people that we are training, the future workforce of behavioral health, they are going to increasingly encounter a more diverse patient population. But in that as well, we are hoping to diversify our behavioral health workforce. So we are hoping to recruit and retain individuals from all sorts of diverse backgrounds into our workforce. And so that means that us as supervisors, or those who will in the future be supervising, will also be encountering and working with individuals who represent very diverse backgrounds, various multicultural views, viewpoints, and belief systems. And how do you sort of ensure that you are being responsive to that changing demographic landscape, not only just for your patient and client landscape, but also the supervisees and the trainees that you'll be working with. In 2017, most relevant to sort of my particular field, so I'm a psychologist by training, the American Psychological Association released the multicultural guidelines. They're sort of known as the multicultural guidelines, and they were released in 2017 that also called for more increased intentional attention to issues of culture as it impacts all domains of professional psychology practice. But in those guidelines, there were references to supervision and needing to be more intentional, frankly, about training, ongoing professional development when it comes to providing supervision in a culturally responsive way. As I mentioned, sort of with that changing demographic landscape, we are going to, focus on increasing the diversity of our behavioral health workforce, which is a fantastic thing. But with that, there are some issues that I would, highly want folks to be thinking about is while recruiting folks into the field is really good, and we want to make sure that we're highlighting that, we also want to make sure that we're recruiting them into a field that is helping them to thrive, helping them to promote their cultural identities within that workforce. And so just making sure that we are providing an environment that is supportive, that is culturally responsive, in order for folks to maintain and stay within our workforce. And what we know is that trainees or learners or supervisees have reported that they have had some experiences in supervision that have not been the most positive or the most affirming. And so really trainees and learners and supervisees are, I think, are learning to utilize their voices more so, and so are speaking up about the need for supervision to be more intentional and culturally responsive to their needs. And so they're advocating more for culturally responsive supervision and or supervision to really integrate some of these practices. And so I really appreciate that sort of this newer generation of upcoming, emerging mental health professionals are really advocating for improvements when it comes to supervision. And then obviously we want to prevent harm and other negative outcomes for our learners, our supervisees, and our trainees. As I mentioned, there have been experiences, I'm sure many of you here attending can name experiences that maybe you've had in supervision that weren't the most pleasant or potentially harmful in certain ways. And so we want to ensure that we're not perpetuating that harm, right? We're learning and we're learning the things that we need to do to help improve the state of supervision for the future. And we're also not maybe recreating or repeating the same mistakes that maybe we encountered when we were in our training and learning phase. So I want to put this in context. So in general, when we think about supervision in general, there is not a lot of increased sort of emphasis or mandates for us to receive ongoing training and supervision. There's just really not a lot that governs that. And so there is this question of supervisor competence, frankly. So unless you live in a state like California, where they mandate, if you are a supervisor, that they mandate continuing education in the domain of supervision, a lot of states don't apply that same expectation. And so what we know about sort of the training that folks receive in supervision during their training is that often they receive limited formal training. I know I'm dating myself a little bit, but I went to graduate school about 10 years ago. That's when I ended graduate school. I just entered mid-career. And really, I loved my grad program, but we only had one course on training and supervision and consultation. And it was a combined course. So it was supervision and consultation as a combined course. That was the only course I received on supervision. And then I think when I went to internship and fellowship, I did some umbrella supervision experiences, but generally speaking, my formal training in supervision was actually quite limited. And what we know is that really hasn't shifted a ton in the last 10 years, that there is a little bit more emphasis on it, but a lot of people still do report that they feel like they've received limited formal training on being a supervisor during their training years. Supervision has limited coverage on licensing exams. So when you take your licensing exam for your professional license across domains, there's not a ton of questions or items related to supervision and representing that domain of supervision. Again, sort of maybe insinuating in some way that maybe this is a less area of emphasis, but it really should be an ongoing area of emphasis for us. There are limited requirements post-licensure for continuing education. As I mentioned, unless you're in California or a similar state to California, you don't necessarily have to increase your sort of professional development when it comes to supervision or receive continuing education specific to supervision. All states differ on that. Some states don't.
Dr. Sampilo, yes, sorry to interrupt you.
No, you're totally fine.
Is there any chance you can maybe slow down so that our interpreters can have the time to interpret in Spanish?
Absolutely.
Thank you so much.
Thank you. Thank you for pointing that out to me.
Thank you.
So once you receive your license, right, and you're doing your continuing education for licensure renewals, there are few states that actually require any continuing education related specifically to supervision. Again, it varies by state. But even some states don't necessarily require specific continuing education credits, even related to just diversity. So I previously lived in Ohio, and so I have a license in Ohio, and I still have an active license in Ohio currently. I currently live in Illinois, but in Ohio, you need 3 credits of diversity/ethics. So in theory, you could also not necessarily get continuing education in issues of diversity in Ohio and still have your license renewed, because you could just get your credits in ethics. And so again, I just want to point that out as an example of how states differ in terms of their requirements for post-licensure education. There's also limited guidelines related to the readiness for supervision. I think for a lot of psychologists specifically, and I'll speak specifically for psychologists just because I'm one, I think there is this perception that once you get your PhD and you are officially a doctor, you are ready to supervise. That seems to be sort of the general perception. And that differs in different disciplines, again, just sort of speaking as a psychologist. But that perception of you get your PhD and you're ready to supervise, I think some folks would question whether or not that is the correct perception to have. Because I think there is something to the notion of readiness to be a supervisor. Especially when you're just getting your first job or your first like faculty job, and you're trying to balance like just becoming a new faculty member, transitioning out of training, are you also ready to supervise like immediately? And I think maybe there are some questions around supervisor readiness and more formal ways of trying to assess that. And then there's even more limited is the above. So we're just talking about supervision in general, just being like a supervisor generally. That's what all the previous points are about. Now there's even less when it comes to governing or sort of, continuously monitoring supervisor competence related to multicultural supervision and its derivatives. So when you're talking about multicultural supervision or culturally responsive supervision, that is a very specific domain of like when we think about supervision competence broadly speaking, but it is a huge like area that we should be competent in. But again, when it comes to supervisor training and formal training and supervision, there's even less training related to that issue. Not enough training to be a supervisor in general, but then even less training when it comes to these issues. We also know that from supervisees, that their perspectives when it comes to integrating discussions of like culture and race and identity into supervision, that there are some experiences that supervisees have that tend to be things that we need to improve upon. So often supervisees report that the burden often falls on them to introduce these issues pertaining to culture. So they're the ones who really have to generate these discussions or have these discussions. Sometimes the perception is I have these conversations, but the supervisor is either unreceptive to those conversations or just less supportive of those discussions. And I would say that probably in a lot of cases, it's not that they're unwilling to have those conversations, would be my best guess, but it's more discomfort and not knowing how to engage. But to the supervisee, that might come across as I'm unwilling, I'm not interested, and or I'm not supportive of these discussions. And maybe there are cases where absolutely that is also the experience. But I would also venture to say that based on my experience, based on my work with different supervisors, that sometimes it comes from an area of discomfort. And that supervisors' cultural humility and willingness to engage in cultural opportunities are generally associated with greater supervisee satisfaction. So when supervisors demonstrate cultural humility or inherently, act in ways that are in accordance with cultural humility, and they're willing to engage in those conversations, generally it's associated with greater supervisee satisfaction. So it's a good outcome. We also know, though, that sometimes there's a mismatch between supervisors and supervisees in terms of how this is being done or how this work is being done. So overall, there are some studies to suggest that if you ask like a supervision dyad, right, a supervisor and a supervisee, you ask them about discussions of culture and supervision. You ask them independently. That a supervisor may report that those discussions are going well, but the supervisee may report something completely different. And so sometimes there's a mismatch in terms of the perception of how well we are engaging in this work as supervisors. So in this study, for example, when the question was, do supervisors identify cultural differences and validate cultural identities and or experiences in supervision? The supervisor feedback in this qualitative study, their theme was, they do engage in this process with supervisees. Well, the supervisees themselves, their theme in terms of responding to this question was the supervisor was unhelpful, at times even offensive or intrusive in supervision, right? So again, mismatch. I think I'm doing okay, but maybe to supervisees, I'm actually not doing as well in this area that I thought I was. Number two, do supervisors and supervisees address power, privilege, and intersectionality in the supervisory space. Again, according to the study, the supervisors reported, not sure that I do that, and would actually like more training on how to do this in supervision, sort of recognizing like, maybe there's a gap there and I need some additional training on this. And the supervisees reported that they only really engaged in the discussion when it came to clients, specifically patients and clients, or they didn't engage in the discussions, not at all. And so again, sort of like this idea about a mismatch potentially between the supervisors and the supervisees. The third item being, do supervisors take on the role as a learner? I think, again, when it comes to demonstrating cultural humility, we know that one of the ways that we do that is by trying to not always be the expert. And in supervision, that's hard because there is that power differential. But I think there is an awareness in culturally responsive supervision that folks want to be learning, want to also be growing in the supervision space as well. We'll talk more about that in just a little bit. But the response from supervisors was, yes, I take on the position of a learner. But for the supervisees, it was no, generally not, due to their position of leadership and privilege. So again, just sort of trying to highlight some of the mismatches between supervisor and supervisee perspectives on these issues. Okay, so just continuing to just give a little bit more context for why this is important is we know for supervisee perspectives, there can be challenges, especially in cross-cultural supervision experiences. So cross-cultural meaning that the supervisor and supervisee belong to different cultural backgrounds, and that there are challenges within supervision experiences. So we know, again, that supervisees do report having experiences in supervision that are negative and or not helpful, and are also, as supervisees, if they have themselves not been exposed to those experiences, they have been exposed sort of as a third party by hearing from other peers or their other trainees that they have had some negative experiences. So understanding that there are challenges within this experience. So given all of that, we sort of want to move towards transforming supervision a little bit. And so this was a slide I put together and I'm going to highlight this effort a little bit later in the presentation, but when I went to our department to really try and say, we really need to restructure our training and supervision, this is one of the slides I sort of presented to leadership to get their buy-in. Was sort of this idea that we really need to move from supervision being very transactional, meaning that there's a supervisor, a supervisee, there's a job to be done, and then check the box, we've provided the supervision, to more of a transformative relationship, where we're providing an opportunity for the supervisee to transform their practice. But also in that experience, we're allowing the supervisor to also transform their practice and their practice of supervision. We really are trying to improve this for both supervisors, mentors, and advanced trainees who are also themselves doing umbrella supervision and supervising some of our younger trainees. We're going to do this through in-house learning and professional development. We're going to do it in an ongoing and continuous learning model. And we're going to take multiple methods and approaches to doing it. But I think this is probably pretty standard for really all departments, is that it is going to take likely a larger effort and initiative to really transform supervision, broadly speaking. But it's very clearly necessary, as evidenced by sort of what we've already discussed. So when we rethink supervision, it really does require unpacking and unlearning to develop new insights and new perspectives. So again, we all have been socialized into supervision, meaning how we learn to supervise is generally a function largely of our previous supervision experiences. We pick up what we liked, what maybe we didn't like, we sort of integrate that into our own approach, and then that's the supervisor that we are. Obviously, we have models and frameworks that we probably also follow, but generally speaking, supervision is a socialized experience. We want supervision to really emphasize the whole picture and the whole landscape, right? So we want to see clinical supervision not just as this sort of exists in this vacuum where supervision just occurs in this very small space, very small vacuum space, but really see supervision as part of the larger societal landscape, the broader landscape. And it requires an openness to co-constructing a different supervision experience. And so I want to emphasize that word co-constructing, because one of the things, again, that really makes this a challenge supervision is that difference of power. And part of culturally responsive supervision is really about trying to make that a more egalitarian relationship. Yes, there is a power differential. There's a hierarchy. There's an evaluative process. You can't remove that. But what you can do is engage in certain behaviors or take certain steps to try and make that a more, again, egalitarian, equal-ish relationship. So when folks talk to me, and in reviewing the literature, what are the barriers to discussions of culture and context and community and supervision? These are primarily the barriers. There's lack of comfort. I don't feel like I would do a good job. I think that's also often associated with I'm scared I'm going to say the wrong thing. And so that fear of saying the wrong thing causes people to just not engage. Lack of opportunity or time. Supervision is work. It is a undertaking that comes with time, comes with effort. And sometimes there's a lot to try and pile in there. We have to talk about your cases. Maybe we have to fill out evaluations. There's lots to do. And sometimes having or feeling like there's a lack of opportunity or time to actually engage in these discussions. Feeling unprepared to engage in discussions kind of goes to lack of comfort. Lack of knowledge and or training I haven't received, formal training in culturally responsive supervision. I feel ill-equipped to provide that. And just not having guidance or resources. A lot of what I've heard from doing consultation work in this space is folks really want to do this well. They just don't know how. And they don't feel like there are sufficient resources and or tools out there to help get them started or help move them in the right direction. It's not a lack of willingness or a lack of interest, but more so a lack of having the support they feel is necessary to engage in these processes and practices. So really, we want to try and make the provision of culturally responsive supervision as accessible as possible to folks so that if they're interested and willing, that it's a little easier. So the question is, how do I do it or how do you do it? What we're trying to do, hopefully, with this toolkit that we're creating is we're trying to also make it a little easier to answer this question of how do you actually do it. So the goals of this toolkit are to provide guidance for engagement in culturally responsive supervision. The toolkit isn't going to be all the answers you need. It isn't going to be a blueprint on how to do it because I don't think there's a blueprint. But hopefully what it will do is based on the literature, based on experience, based on consultation, and providing these trainings to folks, and based on the several presentations and things that we've done as a team for this, it's putting all of those learnings together in a way that will help folks decide to take those steps forward. Again, it's not a blueprint because, again, there is no perfect way to do this. But I think there are some things that might make it helpful for folks to take those first steps. So we're going to provide some tools and resources for that support and hopefully facilitate this orientation towards wellness for all supervisees, supervisors alike. So we're going to talk a little bit about some of the examples from the toolkit. So really the toolkit's kind of broken up into these 4 domains. Interpersonal, meaning the work that you're sort of doing on yourself as an individual, right? So outside of the supervision dyad, it's just you as an individual. Then there's the interpersonal stuff. So the work that you're doing in the supervision dynamic or dyad. There are some community components, and I use community as a proxy for sort of like your community culture, whatever that is. So if that's your department, if that's your clinic, if that is your school, your mental health practice, and then largely more your department and organizational component. So that's going to be more of that sort of that leadership structure within where your community falls. So let's talk a little bit about the interpersonal stuff. Again, it's going to be mostly that individual work, but really what we're doing is we're keying in on the emphasis of self-awareness and self-reflection. So sometimes people are like, well, how do I really do? How do I do that? This is probably the tool that I get the most positive feedback on by far, is this supervision journey mapping. It's this idea that we all, again, are socialized into supervision, and we all have had experiences in our supervision that have led us to being the supervisors that we are. But I don't think that we generally reflect on that very much. And if we do, it's maybe not done in a structured way that maybe feels more helpful or tangible to folks. So we created the supervision journey mapping to sort of help provide some guidance, a little bit of structure to reflecting on some of the pieces of supervision that might be important to think about in figuring out how have you become the supervisor you've become. So the journey mapping tool is broken up into these different areas. seminal events, sort of like what experiences have been central to your approach to supervision, or how have you been socialized to supervision? So even just reflecting on those questions. Challenges, which are what challenges have you faced in supervision? What barriers have you faced in bringing your best self to supervision? Again, that could be, it's very individual to you. So it could be time, it could be, feeling like you have lack of energy, lack of support from leadership, whatever those barriers are. But it's just important to sort of reflect on those and then sort of be aware of those, right? Key attributes are strengths. What strengths do you bring to supervision from your own personal perspective? What strengths do you bring? But then also, what feedback have you gotten regarding what your strengths are? What needs do you have? So what do you need to bring your best self to supervision? Sort of identifying what are the key things that you need or resources that you need to really sort of help provide that supportive environment for supervision in the way that you envision it. And then opportunities, sort of thinking about, what are some opportunities for growth when it comes to supervision? What opportunities in the past have helped you grow? What do you find most helpful? And then what other opportunities are there to quote unquote show up for your supervisee? So again, one of the most popular tools that my team utilizes when it comes to some of this work. And then we're also thinking about, again, when we think about the interpersonal piece, that reflection on ourselves, it's really thinking about our positionality and reflexivity in supervision. So what are my salient social identities? What are they for you? Again, you as an individual. What experiences, what beliefs, and what assumptions and known biases influence your supervision process? What dynamics related to power are at play? So obviously there's the just natural sort of power differential between supervisor and supervisee. But are there other issues of power that are needed to be explored here? What contextual factors, so again, community context, social context, larger context, but what contextual factors influence the supervision process? And then maybe the most important item on this particular worksheet is what reflexive methods are being utilized to benefit the supervision process. So positionality and reflexivity really came to be applied to research, right, as a way for researchers to identify and understand their own biases and how that might influence the research process. We're sort of taking that same process here for supervision, where you're sort of thinking about how your own biases may influence the supervision process, but then also what steps are you taking to potentially try and mitigate the impact of those biases. That's where the reflexive methods come in, is identifying what methods are you utilizing to benefit the supervision process and mitigate the impact of those biases potentially. So just an example of some tools that might be helpful in that domain, right? Now, when we think about the interpersonal side, the emphasis is really on steps and strategies for enhanced cultural responsiveness within the dyad, so within the relationship, right? So really, a big starting point is going to be this idea of co-designing. So co-designing is one way that research shows that you can mitigate or sort of address imbalances in power. It shifts the power dynamics. And part of that is, again, because we know that in supervision, there naturally exists this power differential. But how can you create a more egalitarian relationship, even in that context? And that's what co-designing is about. It also will help address, again, that documented mismatch between perceptions of supervisors and supervisees. If you're coming at this from a co-designing process, right? If we're co-designing sort of the supervision experience, you're more likely to be more matched on some of those perceptions because you're aligning sort of your viewpoints from the beginning. It also allows supervisors to set intentions around supervision, to be more intentional about incorporating their learner voice, incorporating their learners' experiences. And you're co-creating the conditions to address challenges that you're probably going to encounter in supervision, such as like cultural ruptures or ruptures in that supervision alliance. So how do you create or how do you co-design? So again, we set the foundation, which is just remembering that each person's supervision journey is unique. So sometimes I'll have supervisees fill out that supervision mapping tool as well. So we sort of know like what they're bringing to the table as well. But when you co-design, something as simple as like, what does culturally responsive supervision look like to you? Even just asking that question and eliciting feedback and response from your learners can be really helpful in understanding, like, what does providing culturally responsive supervision look like to this person? As I mentioned at the very beginning, when I said like some of the terms are used interchangeably, if you look up a definition of multicultural supervision and or culturally responsive supervision, you will get a multitude of definitions. They will all sort of sound similar, but they are different definitions. So just asking someone, what does culturally responsive supervision look like, will likely elicit a range of responses. But it's probably helpful to know where your definition of culturally responsive supervision aligns and maybe where it doesn't. Just understanding sort of maybe the differences in perspectives there. And you can also ask questions like, from your past experiences, what are key components of culturally responsive supervision? So again, thinking back to your supervision journey, what have been some experiences that have demonstrated cultural responsiveness to you? And again, it's a way to just understand your supervisees a little bit better, and also a way for you to reflect on, is this something that I've done? Is this something that I'm comfortable providing to? And then seeking feedback. You can't co-design without kind of checking in and making sure that you're still on like the same page. So an example of sort of setting the stage for this is, I know this is not a static or linear process. Things can and will change over our time together. And so I want to touch base with you periodically on what's going well and what might need more attention in our supervision dynamic. Could we come up with a cadence that makes sense for the both of us? And so this sort of allows folks to say, like, yes, there maybe are going to be sessions where we don't necessarily directly talk about our supervision relationship, but we are going to check in on it and check in on how we're doing in terms of providing culturally responsive supervision on some cadence. It just integrates like these checkpoints, if you will, right, into the process. The reason I put some language here is because that's one of the number one asks we get from folks too, is sort of like, how do I say that? Or how do I approach this? And so again, the language is not meant to be a blueprint. It's not meant to be, this is what you have to say, but more just to give you an idea of how to start those conversations, how to lay the groundwork for some of those conversations, and how to engage. The other thing that we don't necessarily do as supervisors, we have supervisees do them, but we don't do them, is set goals. So we'll tell the supervisees, like, what goals do you have, for your rotation? What goals do you have for this next 6 months, or however long your time with the supervisee is? But we don't necessarily set goals for ourselves. And what we're encouraging, again, with that co-designing and trying to address those power imbalances, is that when you have a relationship with a supervisee, that it's also important to understand, are there things that you need to work on in order to provide effective supervision, effective culturally responsive supervision for this supervisee? And so even just sort of setting some goals for yourselves as ongoing areas of growth in terms of cultural responsiveness can be important. And this is just one way to do that. Again, it's a template that we provide for people so that they can fill out or create their own goals. So just an example. We said feedback is really important, right? And we're going to circle back, occasionally throughout our supervision relationship. We're going to circle back and do these checkpoints. One way to do that is to utilize like a more structured questionnaire. So this is the Critical Incident Questionnaire by Stephen Brookfield, and this was adapted for supervision. And so this can be, especially when you're doing like group supervision, for example, this can be something you disseminate to like a larger group. Where you just ask a series of questions and you get some feedback. At what moment in supervision this week were you engaged? Were you like most engaged? At what moment in supervision this week were you most distanced? So maybe felt disconnected, right? What action did you find most affirming, responsive, or helpful? What action did you find most puzzling or confusing? What surprised you most about supervision this week? And or what content discussed today is still unclear to you? And part of this is, again, to elicit your learner voice into the process so that you're getting some ongoing feedback, and it's a little bit more timely, right? We usually do sort of like those formal evaluations at certain periods, but this is a little bit more informal and asking about very specific actions that you can either take and or change for the next kind of supervision session. So the other thing that is important to talk about when we're thinking about culturally responsive supervision. So we can't talk about culturally responsive supervision without talking about cultural ruptures, essentially. Supervisors may find that addressing ruptures in general are challenging, but then you layer on this issue of cultural ruptures where a rupture occurs in context of discussing issues of race, culture, what have you in supervision. Cultural ruptures can be even harder to address. And so there's no blueprint. I wish there was, but there's no blueprint. But really proactively creating environments that are more conducive to addressing ruptures is really critical to culturally responsiveness in supervision. So again, just some language. I'm not going to read all of this because obviously you all can read it on the slide too. But really the most important piece I want to sort of draw attention to is the co-designing process. Is really this idea that you're taking a proactive approach to asking about how might we address ruptures together as a diet, right? And part of that is just having that discussion up front and acknowledging that ruptures might occur and learning from any past experiences your supervisee may have had with ruptures and reflecting on your own experiences with ruptures, either as a supervisor or as a supervisee. So just an example of language here. So you might have experienced ruptures in supervision before. What did you take away from these experiences? What did you find helpful or not helpful? And more importantly, how can we create a space together that might increase comfort in processing and addressing those ruptures? What I also want to sort of say is that, we do try to also put in some language or talk proactively about, my goal is always to try and work through ruptures with you. And at the same time, I recognize that that may not always be possible. And I want to ensure that I let the supervisee know that I'll support whatever actions need to be taken to ensure that they feel comfortable. But my goal is always to try and work through, those things with them. So again, just some sample language, because again, people ask for how might you say this? When we talk about community, again, it's sort of taking some of these learnings and then how do we create a community of supervisors with buy-in that are sort of doing this as a group? Well, we've created opportunities for peer consultation for clinical supervision. Just like with any professional issue, if you're not sure, if you have questions, it's always important and or helpful to seek out peer consultation. And so having some peers who are also really being very intentional about supervision and really trying to grow in their supervision, having some opportunities for peer consultation can be helpful. Creating a learning community or even a community of practice within your department or your clinic or your school or again, whatever your immediate community is for clinical supervision is also helpful. And then creating a community of care and community accountability. That's this idea that it's not like we want individuals to be doing this work. But when we think about systemic change, it's really about larger forces, larger groups, sort of creating that change systemically. And so really creating, frankly, some accountability within your community or within your department to really try and increase supervisor savvy around these issues is going to be important. And so what can departments and organizations do? Well, first and foremost, we can review our policies and procedures that help govern or structure culturally responsive supervision. I try to tell folks all the time in these talks that it is not enough for just supervisors to want to do this work because everybody has time constraints. Everybody has pressures. Everybody has their productivity requirements or their supervision requirements or what have you. And so it really requires investment from leadership too to understand that building culturally responsive supervisors requires an investment on some level on their part. So how can departments or leadership, how can they create an infrastructure to promote some of this, right? At one of the institutions I previously worked at, they did not give credit for productivity if you supervised supervisees, right? So you didn't get credit for your supervision work essentially, which made it really challenging to really take on additional supervision kind of responsibilities. And so we advocated for that. And unfortunately, they have pivoted and they are now giving credit for supervisors for productivity. But that was a required change in order for us to say, we really want to improve our supervision, but we can't do that if you also don't provide some support for that. We also want to create some policies, again, create accountability. So create policies for the evaluation of culturally responsive supervision. That same department that now gives credit for supervision, they also have a process in place to evaluate the provision of specifically multicultural supervision and culturally responsive supervision so that we can learn from what we're doing well and what we're not doing well. And then we want to ensure departmental and institutional support for ongoing supervisor education and training. Again, creating that infrastructure Do you get designated time for annual trainings or, continuing education related to supervision? Is that something that, your department and institution can help support and put some infrastructure around? But really, again, systemic changes require policies and procedures to also change. So quickly, in the last 5 minutes before we get to questions, I want to go through just an example of an implementation of this toolkit, essentially. So back in 2020, at the previous institution I worked with, again, I lived in Ohio. We had these interviews with current supervisors, current trainees. We were reviewing sort of the existing frameworks and models on culturally responsive supervision. And we were learning that we had a lot of work to do, that we weren't meeting our supervisees' needs, and we had a lot of work to do that. So we did all that, and we made a proposal to our, basically our center head, or our director, essentially. And then we basically piloted some programming around supervision. And then we initiated supervisor-specific programming in 2021 regarding providing, the provision of culturally responsive supervision. So what did this all look like? So there were a lot of components. First and foremost, we did a tour for our supervisors. We wanted them to really have a better understanding of the communities in which they were working with, because it felt like in order for us to provide culturally responsive supervision, we needed to better understand the patients and the communities with which our supervisees were serving. So first and foremost, we created a tour. And it was really just to sort of help supervisors have a better working knowledge of the institutional impact on our community of the hospital that we worked at, and then also just sort of the the impact of the larger societal issues on those communities as well. We received feedback specific, and we asked for specific feedback regarding clinical training and supervision. One of the pieces of feedback was we weren't doing enough in terms of evaluating multicultural supervision, essentially. So we took all of that feedback to then sort of identify what our action steps would be. We then made some short-term, intermediate, and long-term programmatic goals based on that feedback. We then started doing individual and group education and consultation, basically, for our supervisors in our department. So we did a lot of individual and group sort of learning, didactics, professional development and training. And then we instituted this peer consultation program where we created and held started off monthly, and then it turned into bi-weekly, but monthly sort of sessions where it was like drop-ins, where folks who were interested could just sort of come together and have some time to discuss issues related to provision of culturally responsive supervision. And then we implemented some of those specific steps and interventions I mentioned. We instituted a specific multicultural supervision feedback evaluation. We set goals for every supervisor. We did some experiential exercises for our supervisors to have a better sense of how to apply some of this. And then we engage in those CIQ-like processes. So that CIQ was the adapted feedback form, essentially, for more timely feedback. And lessons learned is that our supervisees were much happier. They reported much positive outcomes. But we also recognized that we wanted to think about this long term. So for as much as we were very happy with sort of our outcomes, we wanted to ensure that for everyone that it doesn't take an initiative as big as that. That was an ideal that we sort of sought out, but that even just small steps were important. So even though, we had a larger effort, even small steps, the, culmination of all those small steps together created a positive impact. So even small steps are good. That we really should be responsive to the feedback, and our way that we respond has to be thoughtful and intentional. That was really important for us not to just elicit feedback and not act on it, but really utilize the trainee and supervisee feedback and really be intentional about acting on it. And that supervision is just one domain of praxis, meaning that we really have to integrate these learnings, integrate this action, even beyond supervision. Getting buy-in. So part of how we got buy-in from leadership was really trying to align with their values. They wanted our internship to be, a highly sought out internship. They wanted us to match with folks high on our ranking list. So there were things we needed to do to ensure that we felt like we could do that. And that also tied into some of the leadership's overarching goals. So how do you align on that to sort of help get their buy-in? We wanted to be flexible, as well as trying to figure out not every supervisor was exactly where everybody else was. That we did have to do some buy-in with other supervisors in our department. but we had to meet them where they're at. There were some of our supervisors who trained, decades ago. There were some of our supervisors who were newer in terms of newer faculty, and so they just trained in the last 5 years. And so not everybody's at the same place, nor we're trained in the same ways. And so we really had to be very flexible and very, sensitive to that, and trying to also be an advocate while also understanding maybe some resistance. And I wouldn't say it was resistance. There was some resistance for sure, but there was also just, I think, some uncertainty. And so really trying to work with those folks and figuring out what felt comfortable for them and how could we move them a little bit into areas of discomfort in a supportive way. And then also we had to address the issue of the minority tax. So just making sure that for folks who belong to marginalized backgrounds, that they also had their time and effort compensated for engaging in this work. So that was an important piece for us as well. So I just wanted to sort of highlight that effort as a way to sort of put out an example of how we can do this work and how it was done in one place, but that the tools and the resources were really helpful to pushing that effort forward. And I've shared those tools and resources with other, programs and other schools and other hospitals, and they found them to be really helpful. So we're trying to create that same kind of toolkit because what we, again, have just learned is that folks want to do this. They just don't always know how to do it. And they don't always know or know where to access certain things that might help them start taking some of those steps. So hopefully that was a little bit helpful in terms of thinking about some examples of the toolkit that potentially could be helpful. And then next steps is just the work is hard, like I said, but we can focus on small or marginal gains. Today is hopefully just a call to action for folks to, just continue to push forward a little bit when it comes to supervision. And then just think about what's an individual or group goal that you might have for clinical supervision and what action can you commit to. So I just like to leave folks with questions to think about. And with that, I think we're at the end. So I'm going to hopefully take some questions for the next 5 minutes. And then there's some housekeeping things we want to do.
Thank you so much, Dr. Sapiro. Very, very useful information. Yes, we have a couple of questions in the Q&A chat box. Let's start with Jill Dougherty. The question is, can you give examples of co-designing?
Yeah, so great question. So co-designing is really, I want to say, it's more of just an approach, but hopefully from the presentation, you got a little bit of what co-designing is. It's basically asking folks for their own input into how you want to create a space, whether it's supervision or whether it's anything else. Co-design is also, it comes from user-centered design thinking and sort of community participatory sort of design, where you're really taking the voice of the other party, whether it's a community, whether it's patients, in this case, whether it's supervisees, and integrating that voice into how you're constructing your work in your space. So more of an approach, not necessarily this very specific step, but in eliciting that voice, what I would say is asking supervisees things like, what does culturally responsive supervision look like to you? What are some things that you find helpful when it comes to culturally sensitive supervision? Eliciting that perspective from them for integration. I would also say when co-designing is you're co-designing sort of goals and also co-designing this idea of how do we create this space? What makes this space a positive one for our discussions of clinical supervision, right? It's when I don't know if you've ever been in a training where at the very beginning, folks are what kinds of ground rules or things do we need to create the safe space? That's an example of co-designing. It's basically eliciting voice to help create a space. I hope that helps.
Perfect. Next question is anonymous attendee. Do you have an example to share of a good policy on culturally responsive supervision? And what are the elements that should be included in such policy, especially in this changing social political landscape?
Absolutely. So one policy that I do think is helpful that we implemented at my previous institution was implementing a policy that required us to evaluate culturally responsive supervision or the provision of that in our department. So we had not been asking trainees at the end of their training year, to please rate how we have done in terms of culturally responsive supervision, and then had certain items like related to that. I think we just adapted an existing survey, and I can certainly like share some of that survey information with you all, because there are some really good evaluation forms out there. But one of the things was that didn't exist. We had the evaluations, but there wasn't a specific evaluation regarding how are we doing when it comes to this particular area of supervision, culturally responsive supervision. How are we integrating that into all of our supervision? How is that like a central piece of our supervision practices? We weren't asking questions specific to that. So we instituted a policy where if you were going to supervise, this was a part of the evaluation process. And that took some buy-in, because I think some folks weren't sure about that being part of the process. But we felt it was really important to know we couldn't make changes if we didn't know how we were doing. And we couldn't make ongoing changes if we didn't know if some of the things we were doing were working or not. So there had to be a method of evaluating that. So that's an example of a policy, like a systemic change, that I think really helps to foster some of this work.
Thank you so much. We have another question. What metrics can be used to evaluate culturally responsive supervision?
Absolutely. So as I mentioned, there's a couple of measures that exist. So there's a multicultural symptom inventory, the MSI, which is in the handbook for clinical supervision that put out by APA. And that it has an evaluation form that was created by, I want to say, Dr. Wong and Wong, I believe. And they did a fantastic job of creating that measure. And so we utilized that measure and just adapted some items to be more direct and intentional about what we were looking for. But that is one measure. There's also sort of just like general measures of the Supervision Alliance that we would encourage you to adapt with some items specific to cultural responsiveness. I think that's one of the missing key areas. Is there are some, like I mentioned, that one measure, there are some good supervision inventories related to culturally responsive supervision, but there aren't a lot of them. And so I think sometimes we end up trying to adapt some of that. There was a Delphi poll done by a team where they sort of, surveyed a bunch of clinical directors and psychologists who really worked in this space, and said, what are the key aspects of like multicultural supervision? And I took that study and really just sort of took the items that came out from that Delphi poll of like, these are examples and these are items that are consistent with multicultural supervision. And I just created that with their permission into a measure that basically is just like a self-assessment where you just sort of check, do I do this or do I not? Or you rate yourself, do I do this well? Do I do this like average? Do I do this not well? Just to give folks at least, again, kind of a way to think about how to understand like where they're at with some of these things, right? Because again, you don't know what to do if you don't know where you're at currently, right? We don't know where we need to go if we don't know where we're at. And so that was a tool that I just had created, but again, adapted from that Delphi poll study. And that will be included as part of the toolkit, is that sort of like that particular goal. And then we reference some of the other tools that are available as well. Again, sometimes I think you have to like add some items or adapt them in certain ways, but there's some stuff that provides a good foundation so you don't have to completely reinvent the wheel.
Great. I think we have time for one more question. So I'm just going to pick one. Please don't come after me. I'll have Dr. Carmen England's question is, any challenges with participants that was not clear or they do not perceive themselves in a specific multicultural group or characteristics that impact the relationship? Oh, sorry, it went up. The supervisee or supervisor. Sometimes how we perceived is not the same as the other person perceive our multicultural characteristics in parentheses, perception differences.
Absolutely. So I think there's always going to be a little bit of like, again, just like sensitively and carefully like navigating some of these issues, because I think there will always be folks who maybe don't always see maybe multicultural supervision or culture responsive supervision as something that they inherently need to work at. And depending on their backgrounds, may not think that it's something that is relevant and or is as closely tied to some of the work that they're doing, just depending on, again, where they're at with this work, when they were trained, if they learned about these issues in their training. And again, I think we've come a long way. There's been a lot of progress. But with that, there is such a spectrum of folks in terms of supervision. And so I think part of it is meeting folks where they're at, understanding where they're at, understanding what their barriers are, and maybe some of the challenges they perceive, and then trying to actively sort of like work with some of those barriers and those challenges in mind, right? I think one of the things that we want to be very careful of is not instituting a mandate on folks where folks really wanted to supervise but just like struggled with this particular issue. We didn't want to institute a mandate where it felt like it caused them to back out of supervision, but we wanted to understand, hey, what are your challenges to this? Like, what do you perceive as the challenges to this? And try to navigate that as like sensitively as we could. And I think that is a delicate dance and a delicate balance, because at the same time, we want to provide the best quality supervision to our trainees, and also understanding that people are at different stages of this work, right? And so it is sort of an ongoing process. And I think part of it is just being able to understand that, but then also trying to be very flexible and being very sort of like dynamic in how you approach this, because again, folks are coming at it from such different perspectives, multicultural lenses, multicultural identities themselves. And so with that, it brings those inherent challenges, but trying to meet them where they're at while also like keeping some goals in mind long-term for the alignment, I think is helpful.
Thank you so much for that valuable information. We have a lot of comments that are very grateful. Thank you for being here, Dr. Sampilo. Please make sure you fill out the evaluation form. It will also be available on the PDF document once you download it. If you don't have a chance today to fill it out, please fill it out once you can. We had a lot of more questions, but we don't have the time for them. Maybe Dr. Sampilo, you can share your contact with the participants so that they can maybe get to you later on. Perfect.
Absolutely. Can I throw that in the chat? Is there a chat I can put that in?
Yeah, we can use the chat.
Okay. And I'll just say, because I know some people probably have to log off as well. You can just email me. My email is m.l.sampilo@gmail.com. Very easy. m.l.sampilo@gmail.com. And then I will put it here in the chat as well. Get it to pop up.
There it is. m.l.sampilo@gmail.com.
And you're more than welcome to contact me.
Perfect. Thank you so much. Thank you, everyone, for participating. Have a good day.
Thank you so much.
Thank you. Bye.